Hi everyone, thought I'd do a quick talk about the ET ties and how we tie ET ties or secure ET tubes within the mouth. As you probably know, we've had increased incidence of sores in the corner of the mouth. So with our patients, there's been a couple of nasty grade 2s just with the way that we're securing ET ties. Now the mouth care group are doing fantastic work. And come up with suggestions. I've just spoken to a couple of the girls and we're trying to come up with a number of different solutions to try and work through why we think this is happening. So the first thing that we think is happening is because this is potentially being tied either too tight or that we're twisting it round too many times when we're securing it to the ET tube. So, as you know, when we're securing these devices, it literally needs to be secured on put the Velcro in at the first instance. And then when we get the blue tape itself, I don't think there's any need for the blue tape to be twisted round as often as we are. So the blue tape will literally be able to be secured and held in place by the Velcro, okay? With one twist. And if you look at the way that the Velcro's secured it, the Velcro secured this tape on properly, and if you look at the tie itself, the tie is flat against the surface of the skin. So what you're not getting is you're not getting the ridging and you're not getting the cheese wire effect that's potentially happening. It's also important to recognise that if we're going to secure below the corners of the mouth, or above the corners of the mouth, that we ensure that these things aren't sitting directly in the corners of the mouth all the time. Because I think what we've been discussing is that this is happening because this gets wet, the blue tapes get wet, and then they act like a little bit of cheese wire because they get pulled so tight. That they act like a little bit of cheese wire and then potentially grip on and cause the sores in the corner of the mouth. So if we have a look and we can try and secure them either below the chin or below the lips, okay, so in this position of the chin here using this bridge, okay, or above, okay, and I think literally the ET tie doesn't need to be tied so many times. The tapes don't need to be tied so many times. The Velcro's there to hold them in position. That's what it's there to do. It's there to lock these tapes in position. You literally need one twist maybe, okay, just to help secure it. One twist which will give you enough length to be able to secure it in the position that you need, and thus making sure that we keep the the tapes away from the corners of the mouth as we secure them on with the white Velcro. Okay, so I hope that makes sense. I think literally the problem that we are having is that, in our aim to try and secure them, that we're maybe pulling them too tight, twisting them too much. They end up like little bits of cord, end up like little bits of rope, and then they sit in the corners of the mouth. It's really important that when we're securing these, we remember that we keep 2 finger space as well. They don't need to be so tight to the surface of the skin. We need to be able to get comfortably 2 fingers in underneath the tapes so that we can ensure that they are tight enough that they secure the ET tube, okay, but they're not so tight that they're acting as a tourniquet or as a potential, kind of something that can cut or abrade a surface. These tapes are designed literally to hold the tube and help secure the tube. They're not designed to retain it in position no matter what. The balloon's there to keep it in position. These are just to help it from accidentally falling out. They're not designed as a deliberate securing device, no matter what your patient's going to do. Okay, so that's one of the potential things that we looked at. The other aspects that we were looking at was the McAllister devices that we use currently. The McAllister device is obviously what we're using presently as an alternative, and the suggestion has been that we look at, from the mouth care group, is that we look at using the McAllister device as a priority, as our standard method of fixing, securing an ET tube in position, unless the patient's going to be extubated within 24 hours. And we'll do this as a trial for the month of May and see if it makes any significant difference and see if we have any significant issues with accidental extubations or anything else like that. The important part when you're using the McAllister device, okay, so the McAllister device itself is making sure that you've got it orientated correctly, okay? So the McAllister device orientated correctly. This tube clip should be at the bottom, and this white bridging device, okay, should be towards the top. The important part when you're fixing these to a patient, when you're sizing these for a patient, is to size this part here first, is to fix that part first, okay? Make sure that's in position. So sit that comfortably to the surface of the skin. Don't fix these bits yet. Don't fix the panels yet. Sit the bridge to the surface of the skin, okay? Get that in position. Once you're happy that's in position, then you can pull off the tapes, okay? And the second person who's doing this will pull off the tapes, and each one of those can be held in position for 5 or 10 seconds, okay? And then you can help secure the tube tightly in position, okay? So the most important with the McAllister device is literally the position of this bridge here. Make sure it's directly beneath the nose, okay, and it's sitting nice and comfortably on this filter. And we've had some occasions where they use the McAllister's been fixed to the skin surface first. McAllister, the bridge device here, has been free of the skin, and the patient's lips have risen up, okay, and every so often you have to keep moving the lip down because the McAllister is actually retaining their lips, you know, away from the mouth, okay. So the two methods that we've got are, if we're going to use this, please try and make sure that it's either secured so that the ties are flat to the surface of the skin and away from the corners of the mouth, or if we're going to secure it below, that the ties again are flat to the surface of the skin and away from the corners of the mouth, because it's that issue, that area, there's the problem, okay? If we're going to use the McAllister device, then it's important that the McAllister device, that we sit, it's at the bridge of the nose, okay? We sit it comfortably, we then take the tapes off to secure it, and we then attach it to the ET tube. Obviously, if you've got any questions with any of these, come and see me or Joe, or speak to the mouth care team, and they'll be able to give you some support and advice.